Hello, my name is Rosa Centeno, nursing student. My name is Bladder, endometriosis. Definition: endometriosis, a condition where tissue resembling the uterus lining grows outside the uterus, such as on the ovaries or fallopian tube. With GIR endometriosis, this tissue grows inside or on the surface of the bladder. Bladder endometriosis is a rare form of the condition that can cause severe discomfort when it forms only on the surface of the bladder. It is called superficial endometriosis, and if it develops inside the bladder lining or wall, it is called deep endometriosis.
Hi, my name is Mr. Faris. I am a consultant gynecologist working at the Lister Hospital in Chelsea in London. Endometriosis is a common gynecological problem affecting women of reproductive age. This can affect women of any age, but is most common in women in their 30s and 40s. 1.5 million women in UK are currently living with endometriosis condition. It is a long-term condition and can have significant impact on the woman's life. Endometriosis is a condition where tissues similar to the lining of the womb start growing in other places, such as the ovaries, the fallopian tubes, the outer surface of the uterus, the inner lining of the pelvis, or on the surface of other organs in the pelvis. Each month, these are cells that react in the same way to those in the womb, building up and then breaking down and bleeding. Unlike the cells of the womb, that leaves the body as periods. This blood has no way to escape and irritates the site where it's attached to, causing pain, some tissue reactions in the form of inflammation, and scar tissue formation. Symptoms of endometriosis can vary. Some women are badly affected, while others may not have any noticeable symptoms at all. Heavy periods could be presenting symptoms, pain in the lower tummy, and back pain, usually worsen during the period pain that stops women from their normal activity, pain during or after intercourse, pain when passing urine or opening bowels, especially during the time of period, difficulty in getting pregnant due to the inflammatory effect and the mechanical obstruction and the scar tissues that are formed by the endometriosis reaction. It also can affect the fertilization and hinder implantation in itself. Endometriosis can be diagnosed by ultrasound scan, which can be helpful especially with ovarian cyst, but can miss other sites of endometriosis. Laparoscopy, which is a keyhole surgery, is the gold standard for diagnosing endometriosis. It could be also used for treatment of endometriosis surgically. Treatment of endometriosis could involve treatment of symptoms, including pain management, painkillers, using a coil that contains hormones that decreases the flow of the period and subsequently decreases the pain. Contraceptive pills can also be used to minimize the symptoms. Surgical management of endometriosis involves removal of endometriosis, release of scar tissues, and removal or excision of cysts that are on the ovaries, but this has got to be large size and fulfilling certain criteria. When approaching surgical management in view of fertility plan, the surgeon must put in consideration minimizing any risk to compromise the ovarian performance, especially when we are removing cysts on the ovary. Assisted conception in the form of IVF can bypass most of endometriosis problems. Hysterectomy, which is the removal of the womb and the ovaries after completing the family, could be the definitive treatment.
Application symptoms include feeling the need to urinate urgently, frequent urination, pain when the bladder is full, burning or painful sensation when passing urine, blood in the urine, pelvic pain. Diagnosis methods: check for any abnormal growth of the bladder, urine exam to detect any blood, perform an ultrasound.
Hi, I'm Dr. Jyoti Paraparath, OBGYN with Caremind Medical. Endometriosis is an often painful disorder affecting at least 11% of American women between the ages of 15 and 44. It is especially common among women in their 30s and 40s. Endometriosis occurs when the tissue lining of the uterus grows outside of the uterus. Bleeding or spotting between periods, painful periods, infertility, pain during intercourse, and/or with urination and digestive problems are common signs and symptoms. Endometriosis is typically found on the ovaries, fallopian tubes, tissues that hold the uterus in place, and the outer surface of the uterus. Fortunately, effective treatments are available. There are several ways to reduce the chances of developing endometriosis by lowering the levels of estrogen in your body. This can be done by taking hormonal birth control, exercising regularly, keeping a low percentage of body fat, avoiding large amounts of alcohol and large amounts of caffeinated beverages. While there is no cure for endometriosis, medicinal and surgical treatments can help with symptoms that lead to pain and discomfort. An early diagnosis often results in better management of symptoms. If you suspect you may be suffering from endometriosis, or if you'd like to learn more about your treatment options, make an appointment with a Caremind Medical OBGYN today.
Pros and cons. Pros: low mortality rate, treated with laparoscopic system giving good result. Cons: in more advanced cases, total removal of the bladder could be necessary, could lead to stage 4 endometriosis, growing in several of the pelvic glands.
Endometriosis is a common chronic gynecological condition, and it's characterised by tissue like that which lines the uterus, which we call the endometrium, depositing outside of the uterus, which normally will happen within the pelvic region, so the ovaries and the area behind the uterus, but it can affect almost any organ in the body. So endometriosis causes pain for people, and particularly it causes pain with periods. It can also cause pain with other activities like having sex or just going to the toilet to pass urine or to pass bowels. And it can also cause quite heavy and dysfunctional bleeding for people, particularly again with their periods. Endometriosis has a strong association with infertility as well. So some people with endometriosis will be diagnosed at the time that they're trying to fall pregnant or have a baby. At the moment, the gold standard in diagnosis is to do a laparoscopy, which is a keyhole surgery where a gynecological surgeon will make a few small incisions in a woman's abdomen and put some cameras in and to have a look around. And then they look at the lesions and can also biopsy them to see the sort of tissue that's in there. My project and some of the work that's being done now is to look at more non-invasive ways of getting a diagnosis for people. So around the world, there's been a lot of research coming out about the use of transvaginal ultrasounds to pick up the deep form of the disease and the ovarian form of endometriosis. One of the limitations with a lot of that research, though, to date has been that those studies have come from large endometriosis specialist centres across the world, where those scans are done by very ultra-expert gynecologists that have a lot of surgical expertise and a lot of expertise with the disease of endometriosis. Unfortunately for a lot of women in the community, if we're going to go and have an ultrasound scan, it's going to be done at a suburban radiology or imaging type practice, and you're going to be scanned by a sonographer who's an expert in ultrasound imaging, but not necessarily an expert in gynecology or in endometriosis. So it's a bit questionable at this stage whether or not the excellent results we've seen in the studies to date really translate very well to the wider community. So what our project is looking at is whether or not sonographers in an imaging practice, or those specialising in women's imaging, can replicate those same results that we've seen to date and potentially help to expedite the diagnosis of endometriosis for women.
In sweat applied in Ecuador in a study during surgical sterilization between 2 and 18% at endometriosis, 5 and 15% infertility related to endometriosis, 17 and 18.5% of urinary tract endometriosis are associated to the bladder. Conclusion: bladder endometriosis is not reported to have a great mortality rate, but it may cause a lot of complications such as an urgent or frequent need to urinate, pain when your bladder is full, burning, or pain when you urinate, blood in your urine. If not treated, it may lead to more severe complications such as kidney damage, cancer, or infertility. Thank you.